Hello, this is Roumen. Welcome to another episode, or series, I should say, to the Roads podcast and show, where we want to highlight the people that are out there in the field, visiting hospitals, rehabs, orthopedics, neurosurgeons, you name it, podiatrists, family medicine, general practitioners, and often the first voice the patients hear when they start their home health journey are account executives. Please meet one and only Mr. Dylan Slasberg,
Thank you for
who
having me.
manages the Delray and Boynton region. So, Dylan, welcome.
Thank you.
Uh, Take a little moment and just tell us a little bit about Dylan. How did you come into home health and what brought you here today?
Sure. So I kind of grew up around this. I was a server at an ALF when I was in high school before COVID and during COVID, so I saw how that affected a lot of patients. My stepdad owns and runs a private duty company, and my mom used to be a director of sales and marketing at an ALF, so I was always around it. And I know they help people every day, and I thought, you know what, why not dip my feet in, get my toes wet, and see what it's all about.
And when did you start home health?
I started about 6 months ago.
And you've never done this before.
I have never done this before.
And I can tell you, as we see a lot of our account executives, Dylan's is one of the best, probably one of the hardest workers we have out there in the field. And it really shows because you're not just out there working, but you're helping change people's lives and help them through the toughest process when it comes to home health because a lot of people don't know about it. Walk us through a typical day for you.
Sure. So wake up 6:45 or 7, shave, shower, shine, get ready for the day. Maybe do a little Starbucks in the morning. Get ready, match the pink shirt,
Yeah.
strawberry refresher, you know. And I go see my accounts. I see if anyone needs anything. Go say what's up to my friends that I've made. See if any of their current patients or residents need any help. A lot of the time, by the time that we see either the residents or our patients, it's usually when they're at their worst. So we get the patients when they're going through it all, when they're, if whether it's a family member, an adult child dealing with their parent that just fell.
Yeah.
They're usually very stressed. They don't know what's going on. So I go around ALFs, SNFs, hospitals, rehabs, PCPs, orthopedic, urology. I mean, most doctors. I manage all of Delray and Boynton Beach, so I go around there, seeing if anyone needs anything, if I can help them out in any way.
And you were in a small centralized area, not spread across the state or multiple counties like a lot of other agencies.
Yes.
Would you say that brings more value to those patients or those accounts?
100%. So something that I like to tell a lot of my accounts is if you guys ever need anything, I can bring something by, pick up some paperwork, whatever you need. I'm no more than maybe 30 minutes away from every office that I go to, and I can see patients. I do bedside visits if they're in the hospital, rehab, they're home.
Yeah.
I'm only a call away, like 30 minutes max.
And we'll kind of get to that later, but let's jump into it now. What's a common misconception about your job? Because you're saying I do bedside visits, I'm interacting with the patient a lot. What's a common misconception that a lot of people have about your role?
So something that I hear a lot is they look at me and they think, oh, it's just another rep. I get the term rep
Yeah.
on me a lot, and at least for me and every other account executive at this company, it's just not the truth. We do everything from start to finish. We manage the patient's care. We always call them first or visit them first, depending on their situation. Make sure that the clinicians, nurses, providers, therapists, anyone who needs to goes out to see them. And yes, being a rep, marketing is part of my responsibilities, but it's not all I do. We are much more involved.
And I think that's what makes us stand above the rest when it comes to this industry and this profession and ultimately the clients we serve, the patients. And I really do think it has a true effect on the patient outcomes. Um, Tell us a little bit, like maybe a story with a family member or a patient that you had to go above and beyond or had a big win with, or maybe it was challenging, but you found that solution for them. Is there anything come to mind of a moment like that for you?
Multiple, yeah. I mean, let's say for starters, there's like kind of what we were talking about before. There was a daughter of one of my patients, freaking out. Her mom fell. She was in the hospital. She had never heard of home health care before. She didn't know how it worked, what it looked like, what it meant, if they would have to pay, if it was covered by insurance. So I sat down with her. I mean, it was on the phone, but sat down for a while, explained everything, how it was going to work. And by the end of the call, she was completely calm, on the same page with me, and she was just very thankful that she knew that she can. I always give them my personal number, say, listen, I'm here for you 24/7. You can call me anytime with any questions, concerns, because I get it. It's stressful, especially when it's your own family member. You want to make sure that they get the best care. Um, you want to be fully aware of what's going on, and that's why we're here.
Especially like you said, they had no idea about home health. They'd never done it before,
Hmm.
and for families to get involved with that aspect, a lot of them don't know where to start. There's a lot of companies out there, and I said this on a previous show. Will you get lucky with the right company? Will you get lucky with the right account executive? A lot more account executives or whatever roles they want to give themselves. I've noticed they're a lot less involved with the patient.
Yes.
And I think that's something special that we, the Roads, do as an organization, but most importantly, you guys, the account executives here. I feel that you're a lot more involved than the average, and I think it serves a much bigger purpose than people think. And I think it all relates to the outcome, the patient outcome, which is the ultimate and primary objective
Of course.
of our organization and ultimately you.
100%. And just, I mean, to touch on that, the way that I like to think about it is, if this patient was my grandparent, how would I want them to be treated? If they're calling me and it's after hours, whatever, it's after 5, of course I'm still going to pick
There's
up.
there's
Yeah,
no
there's
such thing.
no such thing as after hours. If they're calling me, later in the day, whatever it is, I obviously I pick up, because I would say, okay, well, if it was my grandparent, would I want them,
A hundred
to
percent.
be able to reach who's managing their care? And the answer is always
100%.
yes.
Tell us a little bit. We're going to change it up a little bit here. What's one of the toughest objections you've gotten from a patient or referring account? What's the pushback or maybe an uncertainty that they've shown? What's a challenge that you've had?
Sure. I mean, I'd say one of the most common ones is this covered by insurance? Is always the number one question that I get. And we take most insurances, so the answer is always yes. I say, listen, none of our patients ever pay anything. Your insurance covers all of this. That's probably the biggest one that I get. In terms of challenges, there's so many home health companies out there. So it's just seeing if the doctor gives us a shot. They see that how involved I am, how involved we are, and see that we really do care about the patient outcome at the end of the day. That's what's most important. And just seeing how we help our patients, how we serve them.
And because this has come up in the past, what would you say you do when you do receive a patient, but let's say we're not in network with that insurance or you can't handle
Yeah.
that insurance? Does the buck stop there or?
That's where it's time to shine, right?
Yeah.
That's where I would say, listen, I have even though I'm only 6 months in, I have a pretty big network of other agencies with their phone and fax number and the insurances that they do accept. So I'm never, and I say this to all of my offices, I say I'm never one to just say, hey, sorry, I can't accept it. Bye. I
Yeah.
like to help them out afterwards. So I'll say, hey, I can either do one of two things. One, I can either provide you with the company's phone and fax number, and you can do it. Or two, since we already have all the documents, if you're okay with it, of course. We never send patient documents without their blessing. I'll say, if you're okay with it, I'll just fax it over for you. You don't have to worry about it. So the goal is anytime anytime they see home health care, think of Dylan, send it my way. If I can take it, great. If not, I'll send it to someone who can.
Try to be a one-stop shop.
One-stop shop, Amazon.
The Amazon of home health. I like that.
Yes.
And I love when you said that to me a while ago. What do you hear most from families in regards to frustrations about home health? What are some questions they have? What are some issues they have? Because a lot of them, like you said earlier, they've never done home health. They've never been a part of home health. What are some common things you hear out there from the families themselves or from the patients when you call them, when you make that first contact?
Sure. I mean, the first thing that comes to mind is, okay, well, who's going to be coming? How many days a week? And this is from the first either phone call or first visit. And at that point, it's just a little too early to know, because I say, it's a great question. I totally understand why you're asking. But first, we have to have a nurse come out and evaluate you, kind of see where you're at, and we go from there. It's really very catered to their needs. We never do too much. We never do too little. So that's probably one of the biggest questions, or at least first questions that I get, is how many visits am I going to be getting? Who's going to be coming? When are they coming? And yeah, we just go from there.
Yeah, and a lot of the times, and you've seen this, the physicians will request a certain amount of visits, but it's the insurance that ultimately dictates how many visits that patient's allowed to get per week. And when it comes to having that connection with their clinical team, because think about it, the patient's at home where they're comfortable, where they're private, and now an outsider is going to be coming to their home. Is it going to be different people? Is it going to be the same person? So I very much see it as a common question or issue or concern, one that I would have for sure.
Yeah.
And once you are assigned, once you do have that clinical team or member assigned to you, um, it's the continuity of care. You're going to get the very same person.
Yep.
And we think that's key towards the progression of the patient and ultimately the outcome and having them feel better and back on their feet and just ultimately a better outcome because that's truly the goal. So
Yeah, and to touch on that a little bit, I mean, one of the things that I do get a lot is, they're wondering if it's going to be the same person every time,
Yeah.
or if it's going to be different people. And that's a pretty common misconception that people think, whether it's the doctors, the MPs, or sorry, the NPs, MAs, PAs, even the patient, they think it's going to be a different person each time. And that's just not the case. We have, nurses and therapists that stick with the patient and see their care through. And sometimes this is something that I really like about this is some of the patients are lucky and they have, family members around or a spouse that's still alive
yeah,
and they can help take care of them. But I'll call my patients and I'll get calls. They don't have anyone.
Yeah.
They literally have no one. They may be their neighbors, but they're alone.
Yeah.
And these visits, when our clinicians come in, it brightens their day.
Yeah.
I mean, it's human interaction, which everyone needs. And sometimes people forget that. So having the same person come in, they become friends. And we help the patients, physically and their health wise, but it also helps them mentally. I mean,
Yeah.
getting someone in there with them consistently, they make a new friend, and that's sometimes what they need, especially if they have no one.
I mean, think about it. A lot of our patients and those clinicians, once they begin our services, they're not one and done after a few weeks. There's some
No.
of them that are on with us for months and months.
Yeah.
And they do build that relationship. They almost become not friends, but like you said, another family member for them.
Mm-hmm.
And I think that's key and why home health, I think, wins or beats that outside help or outpatient services, as they call it. And it's funny because they think that with home health, you're not going to have the continuity of care. There's going to be some random person showing up at your house.
Where you have more.
Exactly.
Yeah.
And with outpatient services, it's whoever you get lucky on that shift for that hospital or facility or rehab. And it's very much different.
Yeah.
Also, the traveling to, back, you're not as comfortable in your own home because there's something also to be said being comfortable in your home.
Yeah, they don't have to sleep in a uncomfy hospital bed. They can use their own bathroom. Like, little things that you and I wouldn't really think about at this point. But for the patient, they're in the comfort of their own home. They everything, going to their kitchen, sleeping in their own bed with their own.
They're more
pillow.
comfortable and they're much more likely to recover better and heal better.
Yeah,
So
100%.
let's flip it back to the hospitals, rehabs, doctors' offices, physicians. What would you say is one of their biggest complaint or issue when it comes to home health agencies? Because we know they get bombarded left and right with marketing and different agencies that can only do so much. What would you say is a common issue that you hear out there from your accounts that you service?
Yeah, biggest one, communication, poor communication skills. I asked them, what is there anything I could be doing better, or what do you look for in a home health care partner? And it's always quick communication, because they need. Let's say they send out a new patient to X, Y, and Z companies. They need to know, especially if it's a hospitalized patient, because they need to know, hey, this patient's getting discharged tomorrow. We need to know that they're set with someone. And something that is really great about our company is that we can let them know in 30 to 45 minutes if we can accept it or not. And then, like what we were talking about earlier, if we can't accept it, I hook them up with someone who can. So if it ever goes to the roads, the patient's taken care of, whether it's with us or with a different agency, we make sure they're taken care of.
Yeah, because there's been a lot of times, like a case manager, just put yourself in their shoes. It's Friday at 3 p.m. Someone's about to get discharged. They usually get discharged before the weekend because the patients want to be at home. It's 3 o'clock Friday p.m. She has a pile of papers on her desk. She has to discharge a patient and get them some home health. She's got a little list of who takes what. Oh, United Healthcare, this person takes it. They fax it or submit it through their EMR system. An hour goes by. She's about to get off of work and she gets an email or decline. She's back to square one.
Yep.
She's already put that piece of paper on the side as a completed to do, and now it becomes back on the top of the pile of paperwork that she has to complete. So I think what you do for them, what we do for them, is alleviate that.
Yep.
Because it doesn't matter if I can take it or not. I'm in the industry. I'm the expert when it comes to home health. So let me help you. Let me be an extension of your practice. Let me be your resource. It's not the features of the Rhodes Home Health. It's what your life will be like working with the Rhodes Home Health. What are the outcomes going to be like? What's your future going to be like with us? How is your day-to-day job going to be easier when you team up with us and Dylan? Let's bring it back to, we're talking about speed, efficiency. We want to get the patient started and seen. We want to make sure the case manager is happy and satisfied that everything's taken care of. What would you say are some speed bumps or setbacks when it comes to scheduling that patient for an official start of care and having everything in the books for them to be seen? What would you say are some setbacks, not just from a clinical perspective, but maybe from a patient perspective? I know that there's more than one, so
Yeah, I mean, it happens.
what are some things you come across?
Patient-wise, if we are not able to do a bedside, just getting in touch with the patient. I mean, getting them to answer the phone. If they have a caregiver like what we were speaking about, whether it's a family member, an aide, making sure that we can get in touch with them. We need to make sure that we can get in touch with them in order for them to be seen. On the clinical side, just making sure that we have everything that we need in terms of paperwork, documents. We do everything the right way, so we need to make sure we have everything from the get-go so that there's no hiccups down the road.
And I've noticed contacting or communicating with the patient is one of the toughest things, but you have to think about our patient population.
Mm-hmm.
They're not all expert at cell phones and text messages, and a lot of them don't even have cell phones. They have a home phone number.
Yep.
And think about their mobility, especially if they have mobility issues. Can they even get to the phone in time?
Right, exactly.
Before it stops ringing? Do they know how to even check their voicemails?
Right.
So I think it's vital for us not to just get that initial phone number from the face sheet, but also dig in and inquire about any backup numbers, any emergency contacts, and going above and beyond to visiting that patient. And you've done it, and a lot of our account executives do it. If we're unable to make contact with the patient, we try to do a drive-by.
Yeah.
That has saved people's lives. We have account executives that did a drive-by. The patient had fallen. If they were not there, things could have turned out dramatically different for that patient.
Yeah.
So it's really taking ownership of your role as an account executive, what I like to say, executive of the accounts.
Yep.
But you're also the executive of the patient,
Mm-hmm.
and making sure that they get on the right path and steady.
Yeah.
So
And that's where it goes back to, we're here, we're not just reps. It's maybe part of what we do, marketing and making sure there's awareness, but we do everything. We make sure the patients are okay. We manage everything. So that just speaks a lot to that.
And I know you've been in the job role about a half a year. What would you say when you first started, like day one or week one in the field, to now you're 6 months in, you know what you're doing, you've seen your accounts a bunch of times, you're getting very good at all the processes, at understanding the business, understanding the clinical side, understanding how to read the paperwork.
Yep.
What would you say is different from like week one, Dylan, to week 56, Dylan?
Well,
it hasn't been that long, but yeah.
Yeah. Feels like it. My experiences, before, you saw it, my very first day, we went into my first office, and I turned around and had to go. I was, and I have no issue public speaking. I've been fine with all that. But for whatever reason, very nervous in the beginning, and it was a lot of fake it till you make it.
Yeah.
And now it doesn't really feel like faking it anymore. I'm comfortable with the people that I talk to. Even if it's someone that I don't know, I'm comfortable in what I'm saying. I know that, I've learned a lot, and I still have a lot more to learn, but there's no faking it. The confidence is all real.
Yeah.
And if there's a time I don't know the answer, I used to do it in the beginning too, but I would tell them, that's a good question. I don't know. Let me figure that out for you, and I'll get right back. But definitely just being comfortable.
Yeah.
Truly being comfortable. And it more so feels like going around seeing friends at this point rather than Check mark, check mark, check mark, check mark. This place, this person, whatever.
Yeah. Um, how to get comfortable with something? Repetition.
Yeah, yeah.
You do it over and over and over and over. That thing becomes not something new, but something common.
Mm-hmm.
And when it becomes common, you're more comfortable with it, and
You don't even need to think about
more
it. Yeah.
100%. So, what would you think makes a home health agency the prime choice for doctors or case managers or social workers to select and work with? What do you think is that it factor, that thing that makes them choose Dylan or the roads? And who do you think they're really choosing? Are they choosing the roads, or do you think they're really choosing Dylan?
Right. So I mean, it's always they don't know the ins and outs of our company. They know who comes in and represents them. So
And how hard they work?
right, exactly.
Yeah.
So they know if I'm working with Dylan, he's going to go above and beyond to make sure my patient's taken care of. Yes, they look into geographic regions, which we have one of the largest. Insurance is accepted, which we have one of the largest.
Yeah.
Skills we offer, which are one of the largest.
Yep.
But ultimately, it comes down to the person that they're working with.
Yeah.
Because that's going to be the one who, gives them updates on the patients. Hey, this patient was seen today. Everything's all good. They know that when they're with us that they're going to have quick communication. If there's any questions that need to be asked or answered, I'm there. We're there. And ultimately, it comes down to the manager, the account executive.
Yeah. It's attention to detail and being a hard worker. Because I would most certainly team up and do business with uh, someone that loves their job, someone that's passionate about
Yeah.
their job, and someone who works their tail off.
Yeah.
So
People
props
want
to you for bringing all that and some to the table.
Thank
Dylan.
you. Hard workers want to work with hard workers. It's a respect thing. They know it's going to get done right and done well. So it's what they look for. It's what I look for.
And lastly, is there anything you would like to share with us about your journey with the roads, or in the home health world, or with your accounts, or about your life? Anything you want to say goodbye to the world with?
Yeah, sure. I mean, like we talked about in the beginning, I have never done this before. I did physician consulting after college, which was sitting at a desk all day making calls.
Yeah.
Surgeons all over the country, anyone who holds a scalpel. It was a grind. Other than that, no outside sales experience, let alone medical sales experience. And I came in here not knowing much. I was very nervous in the beginning, thinking there's so much to know, so
Yep.
much I'm going to need to understand. But anyone can do it. I mean, you just have to have that hard work and the ethic and the willingness to learn, and roll the punches. Not every day is going to be perfect. There's going to be some roadblocks and obstacles that you need to get around. But if you have the right support team and the right head on your shoulders, you can do it. Just take it one thing at a time. I mean, I'm 6 months in. I'm still learning. I'm sure I'm going to learn
Dylan
something
is
new.
6 months in, and by month 3, here's a top 5 account executive within the entire organization. And I know you don't have to brag about it, but I will. And we call him a diamond. Dylan was a diamond that we came across, and we very much appreciate you being with us, serving the community, serving the patients. Without you, we wouldn't be able to blossom. Without you, the patients wouldn't get the help they need. And without you, the accounts wouldn't get that support that they need when it comes to sending patients to home health. So we're all grateful and thankful for you. We thank your mama and your papa. They raised you well, so thanks for coming down with us.
Well, I appreciate it. Thank you
Of
for
course.
the opportunity to even be here. I mean, big part of it was you, so thank you for giving me the shot.
Tis my duty
Yes.
and responsibility.
Yes.
So I'm working on my outro. Click like, subscribe, share, or don't. But we're here. We're not going anywhere.
We'll be here.
If you got any questions, send them our way. We love to send and spread love within the home health community. So see you on the next one.